My name is Scott Hedge. I live in Southwest Florida and I'm a commercial pilot, but I also fly privately with a small aircraft. I'm 58 years old and I just got done with the SuperPATH method for my hip replacement on my right hip. Getting in and out of a flight deck or a small airplane, you kind of have to maneuver to get your legs in the right position to get in the cockpit. So, I knew I wanted something that was going to accommodate that again. Being in a small airplane or a big airplane, it's a eye-hand coordination. You use your hands, feet, and legs all at the same time. One of the things prior to the surgery is that anytime that I'd push really hard on the rudder pedals, and that's how you basically steer in both the air and on the ground, especially in a small airplane, is that there'd be some minor pain with that. After the SuperPATH, I didn't have any issues. It's made it a lot easier to get back in the air. When we started talking about the SuperPATH method, to be honest with you, I hadn't heard about that before. I went into to my normal orthopedic surgeon, and he said he had this new SuperPATH method, and I kind of talked to him about it, and he explained what the benefits were, and faster recovery, less cutting of muscle and tissue and that type of thing, and that really interests me because of my previous situation, I'll say. I had done a hip replacement on my left hip about 8 years ago. I went down to take a picture, kind of popped back up, and my hip came out. Just never thought that it would displace, but that was one of the other things that brought me back to the SuperPATH, because one of the key things is I can be anywhere in the world, and I don't want to be someplace in Lagos, Nigeria, and something like this happens, and again, that's why I kind of went with the SuperPATH method. That was a huge benefit for me, and my recovery has been probably about 40% quicker, and able to go back to pretty much my normal life now.
Some patients have had hip replacement before, and they will tell me this one is definitely quicker, months ahead. The muscles that stabilize your pelvis when you're walking, when you're running, or doing any kind of sports, they're attached to that greater trochanter, that bone that you feel on your lateral thigh. With the SuperPATH approach, we're not taking those muscles off of the greater trochanter that stabilize your pelvis. And I think that's why we're seeing Scott and others are recovering quicker.
I've been able to get back and do a lot of things that I wouldn't have done just because 2 days later I'd be probably in pretty good pain. Now I can get up and paddleboard. It's a lot of core and you're using your legs a lot. The differences I saw right away with this SuperPATH, there really wasn't any restrictions. Basically, they wanted you to start strengthening right away. I think the recovery that way was a lot faster, just being able to get the strength back more quickly. Definitely say that it's, taking me back to an activity level that I'm more used to when I was younger, so that's nice.